Join us today on World Stroke Day. World Stroke Day is observed on October 29th each year to underscore the serious nature of high stroke rates, raise awareness of the prevention and treatment of the condition, and ensure better care and support for survivors. Munson Healthcare is here on this important day to announce some revolutionary new advancements in stroke care that are now available to all patients throughout Northern Michigan. Next slide, please. Joining us today to discuss these advancements are the following individuals. You'll be hearing from Ed Ness, President and CEO of Munson Healthcare, and also he is also Chair of the Michigan Health and Hospital Association. You'll also hear from Dr. Christine Nefcy, Chief Medical Officer at Munson Healthcare, Matt Wille, who's the President and CEO of Munson Medical Center in Traverse City, and Dr. Gary Rajah, who's the Director of Endovascular Stroke Program for Munson Healthcare. So before we begin, next slide please, I just want to let you know how you can ask a question throughout today's session. We're obviously using Zoom. This is a virtual meeting in these COVID times, so we appreciate you joining us. We will have a Q&A session with all the panelists at the end of today's presentations, and we'll be using the Q&A feature on Zoom and not the chat feature. So please use the Q&A button at the bottom of your screen to then click on that and type a question into the box and click submit. We'll be monitoring the questions and gathering them and bringing all of our speakers back at the end of today's presentation for a quick Q&A session. Next slide, please. So without further ado, it's my pleasure to welcome Ed Ness, President and CEO of Munson Healthcare, and he's going to discuss ways that Munson Healthcare is transforming care delivery in Northern Michigan and why this is so important to Northern Michigan. Welcome, Ed.
Thank you, Diane. And thanks to all of you who are joining today. You know, this is with all going on, it's an exciting time. And, you know, Munson Healthcare serves the 500,000 people that live in Northern Michigan, most of which is rural. And when you think about rural healthcare, the needs of the rural patients living in rural areas is the same as in urban areas. They want to have disease prevention, timely diagnosis and treatment, and life expectancies that are like other parts of the country. But the reality is that we have to deliver care differently in rural areas because of lots of different problems or challenges, whether it's lack of access, poor population, broadband access, long travel times. We have some unique challenges, which says we need to look at care differently maybe than in urban areas. And one of the top areas that rural areas challenged is recruiting top talent, and whether that's different types of physicians, but especially as it relates to neurosurgeons and specialists, are hard to recruit to this area. So we're very excited about the new program and our new interventions in stroke to keep us top of the game with our provision of care. Next slide, please. You know, this is even more important in our rural areas because of the age of our population. Michigan is set to become the oldest state in the U.S. by 2025. And I think, as most of you know, Northern Michigan has a higher prevalence of elderly than other parts of the state, in large part because of a retiree population. So this makes it even more important that we have innovative delivery models to address programs, especially for something like stroke. Next slide, please. You know, before COVID hit in March, which seems like a long time ago, Munson Healthcare had a strategic plan, and it laid out 6 key initiatives that we thought were important to drive our health system in the care of rural populations in Northern Michigan for the next 5 years. Those 6 strategies are what drive our work. And today, as we talk about an interventional stroke program, they really address 3 of those strategies. One, to be able to keep patients in Northern Michigan for their care. 2, to adopt new innovative technologies to provide care in the rural area, but to be innovative about those technologies so that we are state-of-the-art in providing care to a rural area. And then how do we transform care delivery? This means not only treating people when they're sick, but how do we keep them well so they don't get sick in the first place through preventative care, through screenings and other type of interventions. So as we go through today and talk about this exciting new program, I think it's important to note how this really supports what we think are important for the next several years for our healthcare system and for our rural communities. Next slide, please. So really, as we looked at our needs in Northern Michigan, it was really important to prioritize the resources that are invested to have the greatest impact in Northern Michigan. And as you'll hear a bit later, we think stroke and neurosciences is at the top of the list, and we're very excited to share more about that today. Next slide, please. So to provide more information on why this is so important, I'd like to introduce Dr. Christine Nefcy, who is the Chief Medical Officer for the Munson Healthcare System. Dr. Nefcy?
Thank you, Ed. And thank you everybody for joining us. Next slide, please. I'd like to take this opportunity to talk a little bit about stroke and why we have decided as a system to implement this new program. What you see here is a map of the United States that really shows you the risk of stroke by area, geographic area. And you can see that there is disparity across the country. And you'll see also that in Northern Michigan, we have a higher rate of stroke. Stroke is the 5th leading cause of death in the United States. Nearly 800,000 people in our country suffer from a stroke every year. So as you can see, the impact here in Michigan, this is something that is a concern for us and a priority. Next slide. What we know about stroke is that the access to quick care is really essential. You can see here in this map that the yellow shaded areas are where stroke care is available to patients within 60 minutes. And if you'll look in the Munson healthcare region, up at the top of Michigan, we don't have that capability until now. Next slide. So what we know is that stroke intervention close to home saves minutes, and it also saves lives. Across our 9 integrated and affiliated hospitals in Munson Healthcare, with our air and ground transport and now an interventional stroke team, this technology will help us save both minutes and then lives. Next slide. I think it's important to take this opportunity to review the the signs of stroke. So there is an acronym here called Be Fast, and that really lays out for people what they should be looking for if somebody is having a stroke. So balance, a problem in balance, somebody that seems like they're unsteady. Eyes, so any visual problems that somebody develops suddenly. Face is for facial drooping. Often with a stroke, you'll see one side of the face or the other relax and not have the musculature or ability to smile or wink or do things like that that you would normally. Weakness of the arm, difficulty in speech, so slurring or unintelligible speech, all mean that it's time to call 911. Time is absolutely critical in the signs of the stroke. And so it's really important that when any of those symptoms occur, you get somebody to the care they need. An hour of delay in treatment can mean a 7.7% decrease in somebody's ability to achieve functional independence after their stroke. Each minute you delay causes a loss of 1.9 million neurons. So it's really important that people, when they show the signs of stroke, the people around them get them into the hospital as quick as possible. We would be remiss in mentioning, we are well aware we're in the middle of a pandemic, and certainly with that brings some concern for people in coming to a hospital for their safety. We have taken extensive measures throughout the Munson healthcare system to make our hospitals safe. And I cannot stress enough the importance, if you are concerned that you think somebody around you is having a stroke, to get them into care immediately. The quicker you can make it to a Munson healthcare facility, the better your chances are of mitigating the damages of a stroke. Next slide. So we estimate right now that we transfer between 200 and 250 cases downstate annually. We will now, with this new technology, be able to keep those patients here, and in so doing, allow them to get the care that they need and the intervention that they need much faster than if we had to transfer them. So saved time is saved lives. Next slide. I'm happy to report this incredible work is already underway. Prior to the month of September, we had not done a thrombectomy at Munson Medical Center, and now we have completed 23. We actually had to update this slide right before this presentation because we did a thrombectomy at 4 o'clock in the morning, and I'm happy to report that patient is doing well. So the other things that this allows us to do are things like aneurysm clipping and craniotomies. So really putting the right talent, the right technology in place has made some really incredible care able to be given at our Munson Medical Center and throughout the Munson healthcare system. So to talk more about that, I would like to introduce Matt Wille, President and Chief Executive Officer of Munson Medical Center, to speak more about the revolutionary technology we're using and the extraordinary people that make it possible. Matt.
Thank you, Dr. Nefcy. And even though I'm the president of Munson Medical Center in Traverse City, in order to make this program possible, it really does involve the coordination and effort across all of Munson healthcare entities in Northern Michigan. Regardless of where a patient presents with stroke symptoms throughout our facilities, our clinical care teams work together to triage those patients to ensure that they get the right level of care as quickly as possible. And so we've been partnering with our local EMS providers, whether that's ground ambulance or air transport, to ensure that the transfer protocols are in place so that if intervention is needed, they can come to Traverse City. Next slide, please. And once they're at the Munson Medical Center, we have now installed new technology that's going to improve the likelihood of positive outcomes. And some of these advancements in the past 6 months are just the beginning. So actually, last Monday, October 19th, we went live with our first ARTIST Icono biplane machine, which is now operational. Dr. Nefcy mentioned a lot of those cases that are being done. Those are now being done on this new machine that you can see on the right side of the screen there. You know, our goal is to have a second one be operational by spring of next year. And there's a lot of advantages with this new technology. You know, one of them is that it limits the amount of radiation that is used. Not only is that beneficial to the patient, but is also very beneficial to the providers, to the team members that are caring for those individuals. It allows for the best image quality so that the best clinical decisions can be made and allows for safe procedures. Next slide. So here's an example of the new imaging quality that we have. So when you look on the left side of the screen, you can see the imaging that we were previously using. And now, as of last week, the imaging that we currently have. You can see it has 2D, 3D, and 4D imaging capabilities. And when you think about those very specialized instruments that are used to go through a human to kind of see different things, you know, having that image quality is very helpful in diagnoses. Next slide, please. This is another example. Again, the level of detail that we now have on the right side, when you look at somebody's skull, it allows, you can actually see the wire kind of being threaded up through that individual in order to care for them as we think about removing clots or treating aneurysms. Next slide. But beyond technology, we want to also attract top talent. And so I had mentioned we now have this new ARTIST Icono biplane. We are only one of 7 hospitals currently in the country that has it. That is how brand new and state-of-the-art that it is. But also with technology, we are investing in smartphone applications as well. And so when you look at the right side of the screen there, that is an image that can now be sent to our neurosurgeons once a patient is scanned at Munson Healthcare, so that as the physician is going to care for them, they have an idea and a treatment plan that's already being informed with them. And this is the same type of technology that Dr. Gary Rajah, who joined our team in June of this year, used when he was being trained out at the Gates Institute in New York, which is a national center. Next slide. You know, ultimately, we have a lot of goals, and we want to evolve the program as best as we can. Through the use of this technology and the coordination with our other facilities and EMS providers, we're going to be able to continue to recruit new talent to Northern Michigan. So I mentioned Dr. Gary Rajah, who has just joined the team. We're going to be having other partners join him as well so that we can expand our services. Our ultimate goal is to become designated as a comprehensive stroke center. We are currently a primary stroke center, and that comprehensive stroke center is that ultimate distinction of high level of performance. And although we can do all these cases today safely with good clinical outcomes, we believe having that designation will also be helpful, but it is not needed because we're also able to do all those cases presently. We also, as part of this, will be participating in patient-centered research. Next slide. So with that, I'm going to introduce Dr. Gary Rajah. He is a native Michigander. He was very much hoping to be with us in person today, but he is actually currently caring for patients. Patient needs come first, and so on the off chance that he was unable to join us, we did record his message, which we'll watch just momentarily. But again, though, he has a vast experience and has been trained with some of the best providers across the country. Most recently, he was in Buffalo, New York at the Gates Vascular Institute, and he is our new director of our endovascular stroke program, and he is the one that is now bringing these capabilities to Northern Michigan. With that, let's watch the video from Dr. Gary Rajah.
We're excited to talk to you today about some new technology we have as we kick off this new program. We recently started a stroke program here in Northern Michigan, which will take care of interventional stroke patients in a way that's never been done here before in Northern Michigan. My name is Dr. Gary Rajah. I am a Michigander by birth and did most of my training down in Grand Rapids and Detroit. I did a neurosurgery residency at Wayne State, Detroit Medical Center, and then I did a interventional and vascular neurovascular fellowship at Buffalo, the Canon Toshiba Stroke Center in Western New York. I'm excited today to tell you I've joined Munson Healthcare back in June. It was my first time here, and since that time we've been very busy. In September, we kicked off our stroke program, which takes care of patients across Northern Michigan, again, in a way that hasn't been done here prior in Northern Michigan. We're now able to bring patients into Northern Michigan, Traverse City, and do interventional stroke procedures, allowing them to have their lives back. We're truly excited about this, and we'd love to show you the lab and all that we've been doing here at Munson Healthcare. Come with me, I'll show you the lab here. This is what we call the interventional suite. This is a new state-of-the-art biplane machine, which was just recently acquired. We've been using it roughly 1 week now in clinical use. This machine is called the Artis Icono. It has 2 X-ray cameras, one here and one here, and the patient would lie on the table. We're able to, in real time, with the patient awake, look at catheters that are going from either the wrist or the leg up into the brain and able to locate clots and pull them out carefully, all while the patient's awake. Sometimes we'll even see our patients that came in with weakness on one side of the body or the other, or speech issues, improve right on the table during these procedures. This machine is one of 7 in the United States. It was only recently approved for use in the United States and is truly state-of-the-art. As you see, it has a very large monitor. X-ray doses are kept to a minimum, and the control panel here is not unlike a spaceship. Since opening our doors to stroke, we've done over 20 different stroke-related procedures. We're also clipping aneurysms, coiling aneurysms, with numerous different techniques coming down the road. The possibilities here at Munson Medical Center are endless. If a patient presents at a facility outside of Munson Medical Center, Traverse City, we're able to evaluate that patient by phone and offer that 24/7 expertise around the clock. Furthermore, we can then talk with the providers there to determine if the patient is a candidate for these stroke services. If that's the case, we would have the patient transferred to Munson Medical Center in a time-efficient way. Once here, we would get a special image called a CT perfusion, which would then populate on the phones of people who would be involved in the acute stroke care of that patient. Through these images, we're able to determine if the patient is an ideal candidate for mechanical thrombectomy. If that was the case, the patient would be brought to the angio suite. They'd lie on the table. They'd undergo an awake procedure, again, minimally invasive through the wrist or the leg. And pictures would appear very similar to this one on the screen. We would then identify if there was any blockages in the picture and if we could get a device safely there to remove the clot. In the room with me during that time is myself. There's also sometimes someone from the anesthesia department, depending on if the patient's awake or asleep. We try to do these procedures awake. There's also a technologist in the room that helps run the machine, as well as nurses that help take care of the patient's needs and overall procedural safety and monitoring. So with that, I'd like to thank you for taking the time to listen to this. I'd like to thank you for having interest in Munson and the community within Traverse City and Northern Michigan. And remember, if you or a loved one is having a stroke, the key is to identify it quickly, seek help immediately, and when minutes matter, make it Munson.
Thank you to all of our speakers so far. I hope you enjoyed that video from Dr. Rajah as well. Again, he really wanted to be here with us today, but it is exciting that just as we speak, he's helping another patient right now, which is really great news for Northern Michigan. I just wanted to point out before we get to our Q&A session that there are additional resources available on the munsonhealthcare.org website. If you go to munsonhealthcare.org/minutes matter, there is really helpful information for patients, for your loved ones, and for the media out there, all the way from this, how to prevent strokes from happening to how to recognize the signs and symptoms, what to do when you think you're having a stroke, the different treatment options available, and then also a lot of resources on recovery and post-recovery resources and support that are available here in Northern Michigan through Munson Healthcare and our regional partners. Next slide, please. So now I'd like to bring back all of our speakers, and we will be answering some questions that have come in. We've had quite a few come in so far, and I think this first question is for Matt. How many of the biplane machines do you think we will need? You mentioned that we have one, and I know we're actively fundraising because we want to acquire additional ones to meet the demand of those 200 to 250 patients that Dr. Nefcy mentioned in her presentation, but how many do we need to meet this demand?
Yeah, good question. You know, the long-term goals of the program can be achieved through a second biplane. And so again, we are actively working with our foundation to help support that effort, and we have that goal to have it in place by early spring. So after that second one, we will be fully full capacity from a technology standpoint.
Great. And Matt, while you're speaking about that, we have a related question, which is, we had announced pre-COVID that we were going to be doing an operating room expansion at Munson Medical Center in Traverse City. It was also announced that that expansion had been put on hold due to COVID. Does that impact anything related to requiring this second biplane, or are we still on track for that?
Well, really two separate projects. So the second biplane is not impacted by the surgical expansion project. We are doing that in the main hospital for the second biplane. Related to that surgical expansion project, work has continued on it. You'll see over the last few months, we continue to work on that building and making sure that it's enclosed. And, we are committed to it, and we are hoping that there will just be a slight delay with its ultimate completion. But that is not correlated to the need for that second biplane or where it would be located.
Great, thank you, Matt. This next question is for Dr. Nefcy. Matt actually mentioned the difference between the comprehensive stroke center and a primary stroke center. Can you speak to some of the specifics from a clinical perspective of what those differences are and what we're trying to achieve?
I'd say the main difference really is in a primary stroke center, we're able to treat a particular kind of stroke with medicine. What this allows us to do is to treat all kinds of stroke, including those that can't be managed through medicine but need, you heard Dr. Rajah say, mechanical intervention. So when we have to actually go in and pull out a clot or that kind of thing, that expands that ability. There's two kinds of stroke. There's one that's caused by clot and there's one that's caused by bleeding. We are able to manage all of those kinds of strokes now.
Great, thank you. And while you're speaking, Dr. Nefcy, could you also speak to the safety measures in place to protect patients who might be visiting an emergency room due to a stroke today?
That's a great question, and I think relevant to all of our patients that come to us for regardless of the reason. So we have continued to implement since the beginning of this pandemic the recommendations put forth by the World Health Organization and the Centers for Disease Control. And those include universal masking for all of our staff and all of our patients and all of our visitors. Social distancing when that is appropriate and when we can. So you'll see our waiting rooms look different. Our cafeteria looks different. So we have taken steps to keep people spread apart as much as possible. And then obviously our environmental services team is doing amazing work cleaning with much more frequency, especially high touch areas. And there's plenty of availability of hand sanitizer, water, soap, and all of those kinds of things.
All right, great. Thank you, Dr. Nefcy. This next question is for Ed Ness. Ed, as the chair of the Michigan Health and Hospital Association, you mentioned just some differences in our area, northern Michigan versus the rest of the state. You know, what does this really mean to be, you know, one of only 7 hospitals in the country that, or health systems in the country that has this technology, and how are you really proud of that?
Yeah, you know, I think one of the things that's really important and we strive for within our system is how do we bring the level of care up for our rural communities in northern Michigan. Now, we have a unique challenge, especially in the winter, with travel distance. And it's really tough for a patient to have to travel downstate to whether that's Grand Rapids or Ann Arbor or other places for care. And so we think this is, you know, really an exciting development to put us on the map in the state and to allow our patients with this type of issue to stay in northern Michigan so they don't have to travel and their family doesn't have to travel. So I think it really starts to put our system up with the other really good systems in the state.
Great, thank you, Ed. I have one more question for you. Can you speak to the steps you'll be taking in the next 6, 12, or 18 months to further develop this program? And why is it so important to have advanced technology to recruit new neurosurgeons to the region?
So as I said in the beginning, you know, one of the goals that we've had is to recruit the best and the brightest to northern Michigan. And as we looked at the data, this program was the #1 reason that patients were leaving our area for care. And so as we develop this program, I think it's you need to have the technology and the care to recruit the best. And our goal is to have a comprehensive program so that patients can feel comfortable staying in northern Michigan. And we can address those clinical issues that Dr. Nefcy talked about, getting care more quickly so patients don't have to travel.
Great, thank you, Ed. Dr. Nefcy, there's another question for you. In what other ways has Munson Healthcare expanded its neuroscience program at this time? Are these all emergent cases, or are some of them elective as well?
Oh, that's a great question. So You know, it is in large part, this technology helps us deal with the emergent stroke, but you heard Dr. Rajah talk a little bit about aneurysm clipping and some other things. Those tend to be more chronic problems, or problems that lie sort of dormant until they're not. So this really does expand our ability to take care of neurologic issues, both in the acute and non-acute world.
Great, thank you. And one other question for you, Dr. Nefcy, is what resources, can you speak in more detail to what resources are in place to help stroke patients with stroke recovery post-procedure?
Yeah, so it depends on what the issue is post-stroke, and our goal really is to have a quick and swift intervention so that people can just go home on their own with really mild post-operative or post-stroke intervention. But you know, the things that can impact stroke can be anything from speech to swallowing to gross motor balance. So we have a strong and expansive program really to address any of or all of those issues as they come up with our rehabilitation floors and outpatient resources as well.
Great, thank you, Dr. Nefcy. And one last question, this one is for Matt Wille. Can you speak to the recent COVID surge in the area? If Munson Medical Center was to get another big surge of patients, are we still able to treat these stroke patients as they're coming in? Do you have any concerns about that?
We do not, and that's an important point that Dr. Nefcy raised earlier. If people are experiencing any type of illnesses, whether it's related to stroke symptoms or heart conditions, we are a very safe environment. We have the proper PPE in place for all of our visitors and patients and our staff. We are limiting the amount of people that come into our facility. We are screening all of our staff members every single day before they come into work. So, no, from a safety standpoint, whether you are a COVID patient or a non-COVID patient of any type of symptom, we're able to safely care for you.
Great, thank you. Thank you to all of our speakers today. I would like to go to the next slide and turn it back over to Ed Ness, President and CEO of Munson Healthcare, for some closing remarks.
Well, thanks again for everybody participating and everyone joining and listening in. And there's been a lot of good information that's shared. And so what are the takeaways, I think, that I hope you get out of this 45 minutes we've spent together? And really, in the end, it's about our purpose as a healthcare system of improving the lives of our citizens. And you think about how this very exciting program fulfills that need. In the past, patients requiring this type of stroke intervention were transferred out of northern Michigan to another facility. And patients and their families had to travel many unnecessary miles to receive care. Where now those patients can receive this great care in Traverse City, and the patients can stay close to home. And I can't think of a better way to improve the lives of our citizens in northern Michigan than allow them to receive this great care in their own community. Next slide, please. And in the end, it's not only about the convenience of being close to home, but we think that this will really improve the outcome of care. And as Dr. Nefcy reviewed, time matters when it relates to stroke. And so by having these services close to home in northern Michigan, where we're geographically challenged, we think it really will improve the health of our population and the outcomes of those patients having this disease. Next slide, please. So in the end, minutes matter, make it Munson when it comes to stroke care in northern Michigan. We will have the only healthcare system in northern Michigan to perform interventional stroke procedures. We really are leading the way and setting a new example for rural healthcare delivery that I hope can be used across the country. We will continue to grow and evolve our stroke and neuroscience program. Acquire new technology is needed, which will allow us to recruit the top talent to our region. And in the end, I'd say thank you to all of our communities and to all of our donors. We could not have made this happen, and we won't be able to make this happen in the future without the generous support from our donors and from our medical staff and from our community. So really, thank you for that partnership. It means a lot to us, and it really is going to make a difference for the care of our patients. So once again, thank you all for joining us. Thank you for using this new technology as we continue to work in a different environment, but hopefully it was helpful and gave you some insight into this exciting program. So thank you very much.